Hello, everyone. So, this is Dr. Viola Pierce. I am the owner and CEO of VP Nursing and the Nurse Nurturer, where our goal is to teach nurses how to work from their computers anywhere around the world, make money and owning their own time. So, we're going to talk about RaDonda Vaught today. Now, one of the reasons why I wanted to come and talk about RaDonda Vaught is because this really has kind of changed the game as far as nursing is concerned. So, I'm just going to read to you some of the comments on one of the pages that we have. So, one of the nurses said, so scared for her and all of us that believe in our work and that our hospitals might actually care about patient safety. Never stop verifying before administering any treatment or medication because you will stand alone except for your fellow real nurses. Please, God, keep her safe. And then the second one said, I'm so disgusted and have never wanted to leave the profession as much as I do right now, currently in NP school and questioning finishing. Another comment was praying for the strong nurse. This case has made me truly feel like no one cares or backs nursing besides ourselves. So one of the things that I wanted to talk to you about is the case period, right? So the case is that this young lady gave a paralytic. She was supposed to be going down, and I'm just going to give you the facts as I heard from the trial. So the nurse was going down to give a medication to a patient that was in PET scan. The patient was in PET scan, and as a result of going down and giving this medication in PET scan, she was supposed to be given Versed. Now, Versed is conscious sedation medication. It is a medication where you should be monitored. Um, but the patient was not monitored. The patient was in the PET scan. Anyway, so patient in PET scan, patient was supposed to be given Versed. What patient was given, instead of Versed, was given Vecuronium. When the nurse, which is RaDonda Vaught, when she went to pull the medication, she had to override the medication. She had to override in order to get the medication. Now, the deal is that in nursing, especially when you work in critical care areas, you override medications all the time. That is not something that is new. You know, if a patient comes in, so say for instance, you come into a hospital and you get into the hospital and the patient is, you don't know the name of the patient because they were in an accident or whatever. So whenever the physician orders the medication, sometimes we will override medications, put in Jane Doe, override the medications in order to get the medications to the patient so that the patient can be taken care of. Because a lot of times we don't have the chance to, look up, find out who the patient is and all of that. And so overriding medications is not something that is uncommon at all, especially in critical care areas. So, but this patient was not in a critical care area. This patient was in a CAT scan. This patient was given Vecuronium. Vecuronium is a paralytic, which means that it is there. So the reason why we use Vecuronium is so that we can so say for instance, a patient comes in and the patient is having what's called agonal breathing, right? And agonal breathing is when the patient is not able to fully maintain their airway. And so what they do is they give the medication to paralyze the patient. But when they give the medication to paralyze the patient is monitored, as well as the patient is also there's somebody right there to bag the patient, to intubate the patient so that the patient can be put on the ventilator. That's the whole point in Vecuronium, Irocronium, all of those succinylcholine, and all of those paralytic drugs. This particular case, this patient was not on a ventilator. This patient was not being monitored. This patient was not, did not have any of that going on. She came down, she gave the medication, she overrode the medication in the Omnicell Pyxis, whatever system they have. She overrode the medication. And once she overrode the medication, she gave the patient the medication. Apparently, she left. There was no monitoring of the patient, and the reason why she said she didn't monitor the patient was because the physician said that the patient didn't need to be monitored. But this was earlier in the day. I'm assuming with the patient's admission orders. I'm not exactly sure at what point in time this physician said that the patient didn't need to be monitored. So when you have a physician that comes in, so I'm just going to tell you a story about, physicians who come in and they give, orders on patients. We as nurses hold a right to ensure that, whatever medication that we're giving, that we can refuse to give the medication if we don't think that it is safe or we don't think that it is what it should be. Now, with that being said, she apparently followed the doctor's orders, which was a verbal order. It was not an order that was actually put in the chart for the patient not to be monitored. Now, the second thing is that the patient, whenever you give Versed, now I'm gonna say it on one side of the coin and on the other side of the coin. On one side of the coin, you have patients who are given medications, right? When they're given medications, over my 30 years, there have been medications that look different than what they originally looked like. So they may have maybe in a different bottle. They may, they may be some at one point in time may have needed to be reconstituted and then not. But of course, I don't know what happened here. However, she gave Vecuronium as opposed to Versed. Now, Versed does not need to be reconstituted. And what I mean by reconstituted is that it comes in a Vecuronium comes in a powder form, and then you have a syringe or a vial of sterile water, typically, that you can pull up. You put it in the Vecuronium, you reconstitute it, you mix it up, and then you give medication. Versed does not need to be reconstituted. Vecuronium does need to be reconstituted. So that's that. The next thing is that you have the 5 rights. Now you have the right patient, you have the right drug, you have the right dose, you have the right route, and you have the right time, right? So those are 5 rights of medication administration. And so she got all the everything right except for the drug, right? Which was the main thing because it was a paralytic again. Now, she gave the medication. Now, I had a patient that I had, and this is not the same instance. This is not even close, but it was a patient that came in. Patient was pregnant. The patient had, she was having low abdominal pain. Well, she didn't know that she was pregnant when she came in. She found out that she was pregnant, and she ended up the physician wanted to give her a medication. You have 4 levels of medication whenever you give a patient a medication that's pregnant. The number 1 is that there's A, B, C, D. A is very safe. D is not safe at all. And so he wanted to give her this medication. This medication was a pregnancy category D drug. And the patient ended up, she didn't get the medication because I said, I don't feel comfortable giving that medication, AKA I'm not giving it. And so I ended up not giving it. This is where the buck stops, when it comes to where, you giving the medication. Now, I'm not being judgmental. I'm just saying that this was a drug that was given, and I want your thoughts on it because I really want to understand where we are. So now, after the patient was given the medication, just so let's understand what just culture is too, because I want you to understand what we've done over the years when it comes to giving medications, because we deal with medications that are very, very, they can kill you, honestly. So just culture refers to a system of shared accountability in which the organizations are accountable for the systems they have designed and for responding to the behaviors of their employees in a fair and just manner. Employees are accountable for the quality of their choices and for reporting errors and system vulnerabilities. This young lady reported her medication error as soon as she figured out that the medication error was there. Now, typically, now we had a very similar thing that happened in our hospital, very similar. But what happened as a result of that was that the organization took the steps and said, first of all, they notified the family. In this case, they did not notify the family. The family did not know that this had even transpired. They put on the medical examiner's report, that this patient died of a brain bleed. The patient did come in with a brain bleed, but the patient did not have that wasn't the thing that killed her. The paralytic is what killed her, as reported. So the deal is that she's got this medication that's there, right? And what this our organization did is they took a step further and they said, okay, whenever you pull a paralytic, you have to have two nurses that pull that paralytic. And so the nurse, and whenever we have a patient that comes in and a patient needs to be intubated, we know that we have to have two nurses. And so when we know that, we go ahead and say, Ashley or whoever is you coming with me to pull this paralytic, so that we can go ahead and pull it, because it takes two signatures, which is typically our fingerprint on the Omnicell, and then we have to sign twice before giving the medication. So that would have been a fail-safe to let that person know that, okay, we shouldn't be giving this medication while this person is in a PET scan. So she let the organization know, and the organization did not reveal to the family that this is what happened. The reason why it came to fruition, the reason why it came to light, was because of the fact that there was a whistleblower who sent a letter, or reported it to CMS, Centers for Medicaid Services. So CMS said, okay, they did a surprise visit. So whenever CMS comes in and they do a surprise visit, or any visit at all, what happens is they look at the charts and they figure out whether or not you have practiced unsafely. If you have practiced unsafely, then what they can do is they can put you in what's called immediate jeopardy. When they put you in immediate jeopardy, you can lose your Medicaid, Medicare dollars. Now, that's a huge hit to any hospital system. Just be very clear that most of them will not be able to operate if they do that. So the deal is that they then decided that they wanted to sue this nurse, basically, for this homicide that happened. Now, let me tell you that, and so she was charged with criminally neglect homicide and gross neglect of an impaired adult. So let me tell you what the ramifications of that is. The ramifications of that is, the reason why nurses are such in an uproar is because of the fact that you go to work, you want to help people. That is your desire. That is the reason why you go to work. You don't go to work to harm people. I mean, that's not what we do. The reason why nurses are in an uproar is because of the fact that if this child goes to jail for this, and I'm not saying child, I'm sorry, this woman goes to jail for this this death, then it sets a precedence that other nurses can be charged. Now, another thing is that this was pre-pandemic. This was not after the pandemic. Now, has there been a lot of things that have happened during the pandemic? Absolutely. There's been a lot of things that have happened during the pandemic. And before the pandemic even came, there was a lot of stress put on nurses, and a big workload put on nurses. But one of the things that they said in the trial was that she was a floating nurse. And so they had extra nurses this particular day. And so I'm just presenting the facts of what I've now found out and now heard as it relates to her, and as it relates to this trial. I want to know, because this is a dialogue, this is not a, monologue. I want to know, what do you think? Like, what do you think? Do you think that she should be criminally charged? Do you think that she should even have went to trial for this? Do you think that Vanderbilt holds some responsibility for it? Do you think that her license should be taken? Do you think that she should keep her license but may go through some rigorous training? Because, whenever a person has a drug diversion, right? They go through this rigorous, kind of thing. A lot of times, their nursing license are taken for maybe a year or whatever. So the license are taken, and then they end up getting the license back, but provisional license. And then after the provisional license, then they are required to go through a lot of drug testing. So I kind of want to know what your thoughts are. I want to know what your thoughts are as it relates to this trial because it's been very interesting. And there has been a lot of heated arguments back and forth as it relates to this particular trial. This trial has brought up so many things. And the reason, part of it is that nurses have struggled throughout this pandemic. They have struggled with taking care of patients, with not having, adequate staffing during the pandemic. But, this was again pre-pandemic. And so this was something that, we know that was not there during that time. So I just want to know what your thoughts are. It is important that we understand, what our thoughts are. So, Miss Deborah, Dr. Deborah Clark, she said nurses are responsible for the care they deliver. The nurse broke so many safety practices. Read the court records. Sloppy practice resulted in death. A horrible death of suffocating to death and being unable to move. Call for help or get help. And that is where the problem is. That the problem is that there were a lot of, you know, errors that were made within this case. And so I want to know what your thoughts are. Where you lie. Is what do you think we should do? How do you think that we should proceed from this point forward? Because there are nurses on either side of the practice, either side of it. And I want to encourage nurses who are, going into practice today because a lot of nurses are scared. They're scared that they're going to get criminally charged for, delivering medications to patients or delivering, whatever they need to deliver to the patients. I want to encourage you to just be diligent. Just be diligent with your practice. Understand that whenever you give a medication is there and it could kill the person that you're giving it to. Period. I mean, it's just accountability. And so understand that as long as you're diligent and as long as you are very, intuitive, there's medications that we would commonly give in the emergency department. I saw the medications all the time. Anytime I had a medication that I didn't know, then I would look that medication up and make sure that medication was right for the patient. Because sometimes, a lot of times, the physicians they and not a lot of times, I shouldn't say. There are some times when physicians give medications and the medications are not appropriate for that particular patient. It is my responsibility as a nurse to make sure that that medication does not get to that patient. I remember one of my nurse managers standing toe to toe with a physician. He wanted to give a medication. It was, I want to say it was maybe dopamine. I can't remember. But it was a medication that he not dopamine, it was dobutamine. It was dobutamine. And it was a medication, dobutamine, the medication was to be given, and she would not give the medication because he wanted to give twice the dosage. And per our protocol, we wouldn't give twice the dosage of this medication because of the problems that would arise if you did give that medication. So I just want to know your thoughts. Again, this is not a monologue, it's a dialogue. So thank you, Dr. Clark, for coming in and giving your thoughts on that. So I do want to let you know while we're talking about this, our Nurse Recharge Summit is coming up. It's April 23rd. It's going to be completely virtual, so you can join it from the comfort of your own home. Part of the reason why we're bringing it is because of, years and years and years of, these 2 years. I shouldn't say years and years. Well, it has been really years and years, but these 2 years have been rough for nurses. And so we don't want it to be rough any longer. So the Nurse Recharge Summit is coming up April 23rd, from 9 until 5. You have two levels. One is regular registration. Regular registration is where you're able to come in and you're able to just view the event. The second one is, and this is April 23rd, 2022, because this will be on the sites for a long time. But the second VIP, you will get entered a chance. You will have a chance to be entered to win a $150 Amazon card. You will get an hour with a panelist. Plus, you will get a year's worth of replays of the event. And so we will talk about, there's two things we're going to talk about. We're going to talk about nurse recharging, as well as um, we will be talking about entrepreneurship, because I know that nurses can change the face of healthcare. As we know, we just have to know how to do it and hanging around with the right people to do it. So this is Dr. Viola Pierce. I'm the CEO and the founder of VP Nursing and the Nurse Nurturer, where our goal is to teach nurses how to work from their computers anywhere around the world and making money and on their own time. You guys have a phenomenal rest of your day. Bye-bye.